believe we have Paul Siegert now. Paul, how are you on this glorious Saturday?
I'm doing great. How are you today, Ken?
I'm well. I'm confused because here now there's vaccine mandates for healthcare workers hailed as heroes by all of us just a year ago, and now being vilified for not getting a vaccine. What's going on here?
Yeah, and if you listen to a lot of folks in the media, they're questioning the sanity of these healthcare workers. Like, how crazy are they? They should know better. They should know science, when in fact that may be, in many cases, the very reason they are resisting a vaccine mandate, is that they understand science and they're not pretending natural immunity shouldn't be part of this conversation. It would be hard to imagine that many of them weren't clearly exposed to COVID in the course of their work throughout this pandemic. And I thought we were making some really good strides even in your own state there with Kettering Health before the presidential announcement, where they were allowing employees to show natural immunity through testing. And if they got an antibody test, as an example, they would be able to accept that as an exemption to their mandate.
Yeah.
And that's pretty sensible.
Yeah, as I mentioned in the intro, according to the Ohio Department of Health, nearly half the population in this state, in Ohio, is not yet fully vaccinated. So again, we go back to a conversation you and I have a lot. It's poor messaging. There is a great distrust in a number of people about this vaccine, and I think it all goes back to messaging. And I think it goes back as recent as just a couple of weeks ago, when the message was the people that are vaccinated need to get a booster shot because the unvaccinated haven't been vaccinated, which means that the vaccinated people, their vaccinations don't work. To me, that it's just where's the logic in that? You've got to get unvaccinated people vaccinated because the vaccination doesn't work on the people that have been vaccinated. It's like you can't make this stuff up. And again, I think this is wildly political. And as I said in my intro, you can yell and scream at people, either on social media or just in public conversation or private conversation. But there are a significant amount of people that simply don't want to do this. And in the case of nurses and teachers that we've seen in the last 24 hours, they will lose their jobs. They'll walk away from their jobs. Again, playing into a narrative, a lot of people simply don't want to work anymore. Now these people are leaving their jobs because of this. It's just, this thing to me is totally out of control on a number of different levels. How did we get here, Paul? How did it get to this point?
Well, yeah, exactly as you pointed out, we lost the public's confidence, and we continue to and lose confidence from these highly educated healthcare professionals because we're ignoring parts of the science that don't fit this narrative. I was talking on a show earlier today that's hosted by a medical doctor who's also the CEO of a rural hospital. And he would have been in total agreement with the conversation that we're having right now. In fact, he was on CNN in the last week or so being featured for not supporting vaccine mandates, even though he's a CEO of a hospital, because he acknowledges clearly there's natural immunity. And while the possibility that COVID could get transmitted in his hospital that's a real thing. The fact that not being able to staff his hospital when someone shows up and needs some sort of emergent care from a car accident or something is clearly a greater need that needs to be filled for his community, and they're facing staffing shortages as a result of this. And it's definitely not a one-size-fits-all approach. Is not impacting all areas of the country the same. We already had a rural health crisis. This is taking that knob and turning it up even higher.
Well, I forget what the number is, but it's significant. It might be 600. It might be more than that. Employees of United Airlines were giving an ultimatum, and United is saying, well, it's only a fraction of our workforce.
Well, they have 67,000 employees, right? So they can afford to do that in a way that a rural hospital certainly can't afford to. And there's
my point being is, if a significant amount of those that aren't being vaccinated are pilots, and you're scrambling to find pilots, it's the same as a significant number of people in hospitals that might perform really strategic services. We're not talking about people, and I'm not trying to, in any way, shape, or form, categorize or run down people that do the actual work that needs to be done to make a hospital go, and that is people that clean the hospital, make sure that the linens are clean, the gowns are clean, and all that. That's very important. But we're not talking about people at that level. We're talking about all levels at hospitals, are we not?
We are, nurses especially. We're also, as you pointed out, the airlines talking about it's a greater number of pilots and flight attendants in the United example. And here, another element to that story that really I found to be quite surprising and isn't getting discussed that much in the media. It was, kind of lost in the shuffle maybe. They also accepted 2,000 exemptions, religious exemptions, from employees. So you had 593 that are fired now, and then you have 2,000 that applied for and got religious exemptions. But the way they handled the religious exemptions was to say that you will be on unpaid leave effective October 1. So of course that they're getting sued as a result, and that unpaid leave start date has been pushed to the 15th while it gets sorted out in the courts. But that I thought was a really important point of this story.
Yeah, I agree, but they're not according to what happened yesterday with Sotomayor and her ruling on teachers, and then last month, obviously a very conservative judge, Amy Coney Barrett, who denied an emergency appeal from students at Indiana University in August who were appealing to the Supreme Court, not wanting to get vaccinated. In both cases, the Supreme Court sided with the employer, which would be Indiana University, and the employer, which would be the state of New York that employs these teachers. So I'm not sure where court sanctuary exists for people that don't want to get vaccinated. It seems to me if you're working, look, hey, you consult a lot of companies, Paul. It seems to me if the company is saying to somebody, you have to get vaccinated if you want to work here, you'll have to get vaccinated. It would seem to me that the law on this is very clear.
It is, and it's become a very tough spot and pretty coercive situation for many. If you look at the vaccination rate in New York State for healthcare workers, in the few-week period of time, or 3 to 4 weeks, between the announcement that they were going to make a mandate and it going into effect, you saw the uptick. I mean, there was a massive uptick in vaccination rate amongst their healthcare workers. They picked up 11 points in 3 weeks. And clearly those were people that didn't want to do it. On the other hand, they also didn't want to go home and tell their family that they don't have a job anymore and that they got fired for cause and don't have unemployment. And I mean, it's a really an impossible decision for lots of these people.
Oh, yeah, it is. Paul Siegert, our guest, managing partner, PCS Advisers, healthcare benefit consulting firm, 35 partner offices across the United States. The governor of California now has made the edict that COVID vaccinations are required to attend school. In fact, the current plan requires students older than 12 years old to receive the coronavirus vaccine to attend class, but he also announced that it would be the first state in America to require COVID-19 vaccinations for students K through 12, even though the teachers aren't required to do it. They have an out with weekly testing. But I'm going over the stats here, and I'm looking at the stats. Since the start of COVID, which, let's just say January 2020, there have been a grand total of 561 total deaths among anyone from ages 0 to 18. So is there science there that would suggest, and I mean good hardcore science, not just we think or expert opinion, that somebody in first grade could infect other people and infect adults? I know anecdotally it's out there, and I've been searching to try and find, good hard evidence as to how many children have affected adults. The numbers don't seem to exist. It's just that, yes, it could happen. So I'm kind of scratching my head. God love the 561 kids that have died from this. But now it looks like it's going to be everybody, every state, with California taking the lead, K through 12. What am I missing here? Because obviously I don't have all the answers. What am I missing?
Well, there isn't hard science that supports it. And it's not, we're handling it wildly differently than other peer countries in this area. In fact, our own education secretary, I believe, tweeted out something this week referencing a study that supposedly did support that these schools could be hotbeds of transmission, and therefore this was a good idea. And one of the authors of the study responded back and said that was not their conclusion. They had no control group and so on. So there isn't any evidence that really supports it. And there's lots of public health experts who are against it. They don't get the same amount of airtime that the Great Barrington Declaration and many. There's just so many that don't support this. And if you I look at the cost to our system are mostly driven by our healthcare system, chronic diseases that are lifestyle-based diseases. And when you look at what COVID has done to these kids by locking them down, having them not have a normal school year, now multiple years in a row, the obesity amongst our children in this country has ticked up more than 10 points through this experience. And that we don't need any new studies to tell us that is going to deliver serious cost to the system and have lifelong implications for these kids. Yeah, it's incredible.
To say nothing of what might be issues with mental health down the road.
Exactly.
I mean, as I said, we have this group over here that'll talk to you about what it does to you medically. And you'll have this group over here that'll talk to you or try to talk to you about what it does to someone psychologically. And you'll have one group over here talking about what it's going to do for you or against you from a educational standpoint. Well, there's no quarterback. There's no spigot that it runs through. And unfortunately, the people that are that spigot or should be that spigot are so politically charged that they can't give you an answer that is at least consistent from one day to the next, if not truthful. So I don't know where we're going. All I know is this, Paul. We have over 10.5 million jobs, that are unfilled in this country.
That's right.
And hospitals and airlines and teachers are being told to take a hike. And it just seems, again, ham-handed, and I don't know how you fix it, but there are a lot of people out there that simply don't want to trust these vaccines and don't want to trust the government. And I don't know how you get them back. I really don't.
Well, I think one very big step we could take is to join our peer countries in acknowledging the reality of natural immunity and not push vaccination as the only way to get through this. And in the UK, they go out and test their population and they determine how are we doing in terms of overall population immunity, herd immunity, whatever you want to call it. And they're able to then capture both vaccinated and those who've gotten the disease and recovered. And we're not talking about it. We're not doing it. And unfortunately, I think this presidential announcement stopped the start of that conversation here because there were organizations like in your state that were starting to accept it. Yep. And that would be a big step forward in gaining the trust back of the population, because there's science, a lot of it coming from our own country that supports it.
Yeah,
so we can't ignore it and be taken seriously.
And those voices aren't heard, unfortunately, because it doesn't fit somebody's narrative. It's puzzling. Paul, you stay well. We'll visit down the road. Thank you so much.
Thanks for having me. Have a great day.
There he is, Paul Siegert.